good morning. This is Scott Harrell with UMHS Alumni Association, and today we are speaking with UMHS graduate Dr. Martin Tarzian. And Dr. Tarzian, I want to welcome you today. And could you just tell us a little bit about your upcoming residency in psychiatry and where you'll be working?
Sure, Scott. Thank you for having me here. I matched into psychiatry at a MetroHealth in Cleveland, Ohio, which is an affiliate hospital with Case Western.
Okay. And what made you want to go into psychiatry as a specialty?
So when I started medical school, I thought I was going to be a surgeon. Then I did a surgery rotation, and I realized that I did not want to be a surgeon. And I was a little bit lost in my rotations because I wasn't sure what I wanted to do with my career. Eventually, I ended up in Danbury, Connecticut, where I was doing my psychiatry, what's it called? Psychiatry
Mhm.
core. And I was enjoying it, but then one particular day, we had a patient who was a little bit psychotic
Mhm.
and another patient who was a little bit manic. And they asked me if I would have my lunch on the inpatient unit with them. So I bought my lunch from the cafeteria and, young medical student, I didn't know any better. I went and sat on the inpatient unit with the manic guy and the psychotic guy, and we had a conversation. And I won't go into the topics that we covered in that conversation, but the way they spoke and the way they communicated and the passion with which they spoke really sparked something in me. And I knew that I wanted to work with people like this for the rest of my life. I found them very interesting and fascinating.
So that you kind of answered my next question. What made you want to go into psychiatry? Was it this specific meeting these two people, or had you always had an interest in the field of psychiatry?
So I've been told by my trainers and professors in the past that I'm psychologically minded, and I didn't really know what that meant. I just took it as a compliment. At the University of Toronto, which is where I did my undergrad, I did a major in psychology, and I kind of stepped away from it because I wanted to do something more hands-on in medicine, or I thought I did when I was a student, but I came back home as soon as I did my psychiatry rotation. I knew inside that this is what I want to do with my career. So I went back to it.
All right, great. And for current and prospective students who are unfamiliar with the specialty of psychiatry, could you just briefly explain what psychiatry is versus some of the preconceived notions about it in the general public?
Sure. I'll start with what the preconceived notions are because I think everybody has an idea of what a psychiatrist is in their head. And I think what it comes down to is there's this assumption that psychiatrists are almost pill pushers,
Mhm.
or you come to me, you list out the things that are bothering you, and I listen for the buzzwords, and then I give you like your antidepressant or your anxiolytic. But psychiatry is so much more than that. It's this kind of holistic approach to mental health. There's a lot of therapy, CBT, listening. And I think what ultimately makes psychiatry different from every other field of medicine and what really drew me to it is the non-falsifiable nature of psychiatry, which basically means that there aren't a lot of labs and tests that I can order to officially diagnose you with a condition. Like if you have anemia, I can order a blood test, see that you have anemia, and give you treatment. But with psychiatry, it felt like a lot more detective work. I had to get through ego defense mechanisms, pathological lying, people not ready to come to terms with what's wrong with them to get to the juxtapose of what their issue is to formally treat them. And I think that's a really underlooked part of psychiatry. And in my opinion, that's the best part of psychiatry is the actual detective work you do when you're interviewing a patient. There's no field, not just in medicine, but anything really where you're almost playing psychological chess with the person in front of you to help them in the end. So I found that to be the best part of psychiatry. And you don't really realize how much you do that until you do a couple rotations in the inpatient units or even outpatient.
Okay. And so what do you hope to accomplish during your residency?
So there's a lot of things that I'm looking at and trying to do inside and outside of residency. During my time, I'm definitely trying to be the best psychiatrist I can be. I'm hoping to be part of the psychoanalytic renaissance in medicine. I think that the Freudians, the Carl Jungs, the Alfred Adlers of old have lost their kind of space in
Yeah.
modern psychiatry. And then I believe, like truly believe in my heart, that there is room in our interviews to incorporate what they taught and what they brought to our field into eliciting the kind of answers that we're looking for. So I hope to get training into that. I know Cleveland has a really good Institute of Psychoanalysis that I'm hoping to be a part of. I do a lot of research on new cutting edge psychiatric drugs. So I hope to get involved in some drug trials, particularly for a medication called lumateperone, which I think might be the future of treating certain parts of schizophrenia. On the side, I'm investing my money a lot more than I used to. I'm looking into different projects to kind of build my wealth as I progress through residency and help me pay off my loans. And then obviously staying in shape. I'm trying to go to the gym every day. So a lot of different avenues I'm kind of focusing on as I go into residency.
Wow. So, just switching gears a bit, whenever you were looking at med schools, what made you choose UMHS over other med schools out there?
So I'll be honest with you. I when I was applying for medical schools, I had a good GPA. I'm Canadian. I had a good GPA at the University of Toronto. It was like around a 3.7. But I had a really bad first year where
Mhm.
I almost flunked. So altogether, I couldn't break past like a 3.75. So I didn't get any interviews in Canada and I got like one interview at a DO school in the United States. So I was talking to my advisor and she told me that my best option would be to go to the Caribbean. And then she told me that there's a big six, like St. George, AUA, Ross, but there's this one new school that has really small classroom sizes, and they really focus on student professor interaction. And the professors don't even do research on the island because they want to focus on education. And that was all important to me. So, and it was UMHS. So
Yeah.
I decided to take my chances and I went to UMHS. And what she said was true. Every professor that I've had at UMHS, I have some kind of relationship with them, even now. So much so that I actually went back, actually got back a few days ago to teach a couple semesters at UMHS in the interim while I wait to begin my residency. Yeah.
Wow. All right. And at UMHS over the years, we've really seen psychiatry going from being a lesser known specialty to one of the most sought after and competitive. And I think it's especially with the mental health crisis during and after the pandemic and psychiatry becoming much less stigmatized. What would you say to people out there considering choosing psychiatry as a specialty with these things in mind?
So I think the secret is out of the bag that psychiatry probably has the best lifestyle of medicine. And I think most young physicians are realizing that and also realizing that lifestyle is more important than making the highest salary. My advice to prospects who would like to be psychiatrists is psychiatry is a little bit different. Every field of medicine is saying that they're holistic and they
Mhm.
want the highest score, or they want different things. Obviously, the highest scores are great, but psychiatry really wants that kind of diverse portfolio when you apply to them. Research, there's journals where you could publish research on whatever fields you're interested in psychiatry. I know when I was in my third year, I published some papers on new psychotropic medications, as well as a history of psychoanalysis. So, pick some fields that are psychiatry related and publish some papers on it. Education, well, during my interviews, the fact that I was a teacher before medical school and a professor at UMHS really, really bolstered my application. As IMGs, we have the ability to write step 3 right after we graduate. So if you find yourself with that golden opportunity, do write step 3. I got a couple interviews just because I wrote step 3. Actually, the place I matched, I emailed them after I wrote step 3, telling them I wrote step 3. And then they granted me an interview, and that's how I matched there. So step three is super important. And then networking. Make sure you do your psychiatry rotations at every hospital UMHS offers. I think we had Danbury, Larkin, Oklahoma. We got a new one in Georgia, and I think we have one in Wisconsin. So rotate at all those hospitals, get letters of recommendation from all those hospitals, and I think you'll be okay.
Okay, I think that's great advice. And is there anything else you'd like to say to our current or prospective students out there?
Yeah, I was just at UMHS, and we don't have a psychiatry club. So basic science students, somebody step up and make a psychiatry club.
Okay. Okay, great. Well, I want to thank you so much for your time today, Dr. Tarzian, and I wish you all the best in your future endeavors, and we'll speak soon, okay?
Thank you.